mode.
Hello, my name is Erica Burrows-Girardi, and I'm a community coach with County Health Rankings and Roadmaps. Today I'm joined by my colleague and fellow community coach, Tony Lewis.
Hello, I will be helping to answer your questions as well as sending some links out via the chat box throughout the webinar.
Tony and I are so excited to welcome Sally Wills and Melissa Fair, both with LiveWell Greenville, based in Greenville County, South Carolina. We'll hear more from them later, but right now I want to welcome each of you.
Hello, this is Melissa. I'm glad to be here. And this is Sally. Thanks for having us.
Thank you, ladies. I want to take a moment to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. And next, let me also take a moment to orient you to the technology we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window where you will see our screen throughout the presentation, and on the right, you can see the control panel. You can interact with us through the control panel by using the questions section. Please feel free to ask your questions or share your thoughts and experiences with us via the control panel throughout our webinar today, and we'll be sure to leave time for your questions. Now, just above the question box, you will notice a handout section, and Tony has already placed two handouts there to provide you with more information related to the webinar content. As we move into the real content of the webinar, we'd like for you to consider these two questions as you listen. Who else do you need to share this information with, and what is one idea for action that you're taking from this webinar? Let's get our audience grounded in the County Health Rankings approach. The County Health Rankings ranks the health of nearly every county in every state. For each county, you'll find two rankings, one for health outcomes and one for health factors. This image that you are seeing now shows the relationship between policy, health factors, and health outcomes. It illustrates why it's important for communities to take a broad definition of health. Many factors impact how well and how long we live. Things like how we commute to work, housing conditions, access to parks, the quality of our schools, access to healthy foods, community safety, and even our social connectedness all impact our health outcomes. So what does this image tell us? Starting from the bottom, we know that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. We at County Health Rankings and Roadmaps specifically look at 4 health factors: health behaviors, clinical care, social and economic factors, and the physical environment. And these health factors shape our health outcomes. And we measure 2 health outcomes for each county. That is length of life and quality of life. You'll see our health factors in the blue boxes and the health outcomes in the green boxes at the top of the model. We release the rankings annually to share information about county health status, but more importantly, we release the rankings to encourage communities to take action in improving its health outcomes. You can mark your calendar for the 2017 release of the rankings, which will be in about 60 days on March 29th. For more information about our approach, watch the County Health Rankings one-on-one webinar that we recorded about 2 weeks ago, and Tony is going to chat out a link for that. Again, the rankings are released to encourage action, but how can communities take action? This image is an image of our Take Action cycle, which sits within our Roadmaps to Health Action Center. The cycle lays out a process that communities can follow to improve health. Within this process are several action steps: gather information to assess needs and resources, set priorities so you can focus on what's important, find the most effective approaches to address your priorities, and then get to work on acting on what's important. And of course, evaluating throughout the cycle will help you improve your strategies and ensure that what you are doing is effective. You'll see that communicate and work together surround the cycle, because working together and communicating with stakeholders is essential throughout the Take Action cycle. At the heart of the Take Action cycle is people working together, because we know that solving issues like childhood obesity, poor high school graduation rates, or crime and recidivism require the wisdom and resources of everyone in the community. The Roadmaps to Health Action Center includes guidance and tools to help communities keep moving along this cycle. And Tony's going to be sharing some links to some relevant tools to these guides during today's webinar, and they'll also be posted online. Now, during today's webinar, we're going to focus on evaluate actions. Evaluating your efforts is an important and ongoing part of improving your community's health. Evaluation helps you know if what you're doing is working and achieving the results that you desire. Ultimately, you need to know if your strategies are working so you can do your efforts as effectively and as efficiently as possible. Evaluating your actions also allows you to course correct as needed. Now, here at County Health Rankings and Roadmaps, we know that evaluating actions are really important, but we often hear from communities that evaluation could be a challenge for several reasons. Communities have questions about expertise. Who do we involve? When do we start? How do we evaluate impact and outcomes as opposed to just evaluating processes? Communities often have questions about data as well. What kind of indicators do we need to use? Like, what it is that we need to, what type of data should we even collect? And how do we collect it? And after the data is collected, how do we analyze it and make sense of it to course correct? And then we also find that financial support can be a challenge for some communities because they struggle financially to implement an evaluation plan that provides enough depth and breadth to be meaningful. Therefore, today's guiding question is, how can we evaluate our impact in the community effectively and efficiently with limited resources? Our guests from LiveWell Greenville will share their evaluation structure, which utilizes a community-based participatory research approach in partnership with 5 universities. This approach has enabled LiveWell Greenville's evaluation team to measure impact on a relatively modest budget and has been mutually beneficial to the partnership and the universities. With that, let's introduce our guest. Sally Wills has been with LiveWell Greenville since 2011, first as operations manager, then as the executive director. Sally brings public health experience to the leadership of the coalition with a strong background in community development, education, and evaluation. Sally holds a master's degree in public health from the University of South Carolina Arnold School of Public Health. In her free time, she enjoys running, hiking, and enjoying time with her husband and children. Melissa Fair was named the LiveWell Greenville Principal Investigator last year. In this role, she guides the full work of the evaluation team to create a cohesive assessment of LiveWell Greenville's impact on creating healthier environments through healthy eating and active living policy systems and environment change. Melissa has been actively involved in the work of LiveWell Greenville since 2012. As a local Greenville resident, Melissa received her Bachelor's of Exercise Science from Furman University, her Master's of Public Health from the University of South Carolina Arnold School of Public Health, and she's currently a third-year doctoral student there at the University of South Carolina. Sally, I want to start with you. Can you tell us a little bit about LiveWell Greenville?
Yes, Erica, thanks for having us. LiveWell Greenville is a partnership of more than 150 businesses, agencies, governments, and leaders working together to make Greenville one of the healthiest places to live in the nation. We are located in Greenville County, which is in the upstate of South Carolina. To give you an idea of how our population size, we have one mid-sized city, which is Greenville, with suburban and rural areas surrounding. LiveWell Greenville is on a mission to make the healthy choice the easy choice by creating and maintaining a community that supports healthy eating and active living. We achieve this mission by using a policy, system, and environmental change approach. So rather than targeting individual behaviors or implementing programs, we work to change the policies and practices within the physical and social environments in which people live. Our current partnership structure includes a leadership team, which serves as our board, and 9 work groups. The work groups are organized around 3 topics: healthy eating, physical activity, and active transportation, and 6 sectors of the community. Those would be schools, out-of-school time, early childhood, healthcare, workplaces, and churches. Each work group is made up of 8 to 15 key influencers, most of which have a vested interest in creating a healthier community that's either tied to their job or their personal passion. Each work group brings together coalition staff, partnering organizations, individuals from the community, and university evaluators and researchers, all who have an interest and expertise in either the setting or the focus area associated with their work group. And while each work group could function as its own independent coalition, it's working together under LiveWell's umbrella that allows for this synergistic impact as we spread across work groups to achieve a collective impact. So for example, our early childhood partners are primarily housed in churches. Therefore, we engage the action and impact from both the early childhood and the worship work groups when fostering collaboration and change in the early childhood setting. In seeking not only to connect these organizations working together in each setting, but also across those settings, we're able to make the healthy choice the easy choice collectively and influence the health of all Greenville County residents.
Thanks. And can you tell us what types of activities you coordinate to influence healthy eating and active living policy systems and environments in these settings?
Absolutely. I think the first thing to address is why we address policy, system, and environmental change. And as a group, we really feel like this allows our work to be more sustainable and impactful. And so as you look at the types of things that we provide to the community, our activities can be grouped into 3 main areas: resources, collaboration, and evaluation. So when I say we provide resources, I mean we work with partners and we might do things like in developing toolkits or providing technical assistance and support, or identifying best practices for evidence-based interventions. And looking at partner collaboration, we do this via regular work group meetings. Each work group has developed their own community action plan that actively connects community partners around mutually reinforcing activities. And in respect to evaluation, we're able to bring research and data to partners who might not otherwise have access to high-level process impact or outcome measures.
Okay. And, you know, when you and I chatted earlier this year, I learned that evaluation has always been fundamental to LiveWell Greenville's work. And if you could, highlight some historic milestones that led to the partnership with the universities that now help implement evaluation.
Yeah, thanks for bringing that up, Erica. LiveWell Greenville's major university partner is Furman University, and Furman has been instrumental in establishing this coalition from our very early days and has remained an integral partner as we continue through our history. So let me go back to 2008. In that year, the Greenville County Youth Obesity Study was commissioned by a local health foundation. It was executed by researchers at Furman University. Findings from this study suggested that the youth obesity rates in Greenville County were much higher than the national average and were disproportionately affecting some population groups. This baseline study helped spark many conversations across our community, especially around 2 groups that were formed, the Childhood Obesity Task Force and Activate Greenville. So these were 2 separate efforts that were working to address childhood obesity. With funding from 2 great resources, the Robert Wood Johnson Foundation and the National Recreation and Parks Administration in 2009, those funding sources helped to ignite both groups and allow key stakeholders between the Childhood Obesity Task Force and Activate Greenville to work collaboratively. And the result became our coalition, which is now known as LiveWell Greenville. We officially launched at the end of 2010 and the beginning of 2011, and as we moved through that year and the next, we were able to hit a major milestone with the receipt of the Centers for Disease Control and Prevention's Community Transformation Grant in 2012. This allowed us to continue to focus not only on evidence-based interventions, but it also gave us the opportunity for in-depth evaluation of those interventions. It also gave us the opportunity to really look at our 3 foundational studies that have been integral to our long-term success in planning as well as our funding sustainability. And those are our food desert study, our park desert study, and our ongoing youth obesity, the ongoing evaluation of our youth obesity rates in Greenville County. The findings from all 3 come together to provide the evidence that we've used to plan most of our interventions, and it definitely gave us a basis for which to apply for another CDC grant, the Partners to Improve Community Health, which was awarded to LiveWell in 2014.
And I know that you guys are very proud of the work that you have achieved since the start of the partnership, and I would love for you to be able to share a couple of examples of these achievements and how they tie into your evaluation efforts, if you don't mind.
Absolutely, and I know when we talked, this is the part I had to limit myself because we could go on and on about all the wonderful things that our partners have put together. But over the years, we have achieved some significant successes with the implementation of evidence-based interventions. So among our most impactful work, the examples that I'll use today would happen in the schools, in out-of-school time settings, and in worship or faith-based communities. With schools, we have a consolidated school district. So Greenville County has 85 public schools. And in all of those schools, we've helped to flip the school culture to be more health promoting in almost every facet of a student's experience. In the cafeteria, we've changed over to scratch-made meals. In classrooms, we have brain breaks and healthy rewards. In physical education classes, we've had a focus on increasing the number of minutes that students engage in moderate to vigorous physical activity. And even in the teacher's lounge, there's been an increased focus on staff wellness efforts. Similarly, we've coached over 60 after-school and summer camp programs into developing policies towards having healthier snacks and spending more time being physically active. And in 15 churches across the county, fried chicken has been taken off the menu. It's been replaced with healthier proteins, fresh produce, and healthy grains. In addition, children are regularly engaging in physical activity while at the church, and there are policies in place to limit exposure to tobacco products. These are just quick examples of the way that we have worked and the way that our partners have come together. And I really want to take just a moment to say, when I say we, I really mean the 150 partners of LiveWell Greenville, not our staff, not our funders. It's truly this collective impact that we have coming together in those work groups. Our work groups use logic models and public health theory and local data to drive the majority of our work. For example, we have looked at how to address the local food system. We used a county-wide food desert study to identify the neighborhoods with the greatest needs. We selected proven interventions like mobile markets, community gardens, healthy corner market strategies to address those needs. And we built our evaluation efforts around these carefully planned interventions from the very early days of planning and worked towards a very logical, community-driven approach.
Thank you so much, Sally, for sharing that background about LiveWell Greenville. And you guys have such an interesting history. So, and for those of you who are listening on the webinar today, I am from South Carolina, so I am particularly proud of the work that LiveWell Greenville has done. And at this point, I want to bring you, Melissa, into the conversation because I want to kind of pivot and focus more on the evaluation structure for your partnership. Now, I know that LiveWell Greenville partners with 4 universities in the state of South Carolina and 1 in Arizona. Tell us a little bit about your evaluation structure and the roles that the universities play in evaluating your partnership's work.
Yeah, certainly. So as Sally mentioned on a previous slide, Furman University has remained an integral partner in LiveWell Greenville's evaluation activities and the overall strategic direction. This has been in large part through the support of a principal investigator position. And as the current PI, it is my responsibility to coordinate the evaluation effort across all of the work groups that Sally mentioned and help guide the strategic direction of the coalition interventions. So having this central evaluation role that is able to understand both the greater coalition strategic direction and the overall evaluation direction has allowed me to ensure that evaluation plans have continuity across the work groups and that they are implemented efficiently and effectively. And lastly, then reported at both local and national levels. To accomplish this task, I coordinate a team of 7 evaluation specialists from 4 academic institutions located in South Carolina. That's Furman University, Clemson University, USC Upstate, and University of South Carolina. And then we also have an independent evaluator who received her PhD from the University of Medical Sciences, Arizona. These individuals come from a variety of social and behavioral research disciplines, including psychology, parks and recreation, public health, and nursing. And each evaluator provides the necessary expertise for the community settings that they serve. So as active members of their respective work groups, not only do our evaluation specialists provide support in the development and implementation of evaluation plans, but they also provide input on evidence-based practices and intervention strategies for each of the community action plans. Many of these evaluation specialists also provide further support to LiveWell Greenville by assisting the development of both coalition-initiated and university-initiated grants. These grant writing activities provide funding not only for our evaluation activities, but operations and community interventions as well. And the final piece of our evaluation structure and framework is the involvement of students. So undergraduate and graduate students play an important role. The evaluation specialists, university partners, and LiveWell Greenville receive mutual benefit through the involvement of students in both community and evaluation activities, while at the same time students are able to engage in projects that enhance their professional and academic experience while also providing support to our community.
And I know that LiveWell Greenville utilizes a community-based participatory research approach, sometimes called CBPR. And you use that approach to help guide your relationship with the universities. Tell us a little bit about what CBPR is, like what are the principles of it and how does it work to advance your evaluation plan?
Certainly. And so at the heart of LiveWell Greenville's approach to policy, systems, and environment change is, like you said, our commitment to utilizing a community-based participatory research framework. So CBPR is a public health research framework that accounts for the important role of community involvement and community context through each stage of the research process. This begins not only with the identification of the community health problem or need, but extends to the development and implementation of intervention strategies and the overall evaluation and reporting process. So the important hallmark of CBPR and why LiveWell is so committed to it is that it equitably involves community members, organizational representatives, and researchers in every aspect of the research process that I just described. So this means that all of our partners have equal opportunity to contribute their expertise in the decision-making process.
Nice. Yeah. So now that you've told us a little bit about CBPR, why don't you tell us a little bit about why you guys have such a strong commitment to using it? I mean, I know you touched on it, but just tell us a little bit more about it.
Yeah, CBPR has multiple strengths. So one of the first is that it builds upon the existing strengths of the community. This positive approach, rather than a focus on identifying community deficits, really builds community capacity and empowerment among community members to actively engage in promoting their own health. Secondly, CBPR fosters sustainability of intervention efforts and long-term funding possibilities, while also encouraging long-term relationships between the coalition and researchers with the community. This is particularly important when we are dealing with historically disadvantaged communities who might have experienced discrimination or negative interaction with universities or researchers in decades past. This long-term relationship helps build trust with the community that can subsequently endure beyond just the grant funding cycle. Another major strength of CBPR is that it recognizes the importance of community context when designing and evaluating interventions. Most importantly, this context is communicated by the community members themselves and is not the impression or based upon the experience of the evaluators or community workers. This is extremely important in the capacity building process and the development of interventions that are culturally tailored and sensitive. And one of the last major strengths of CBPR is it allows us to balance research and community goals. While the researcher may collect data and discover new findings that can be reported at national conferences and in peer-reviewed journals, the most important phase of the reporting process in CBPR is reporting to the community. This community focus allows us to further build trust and allows the community to take their findings and turn them into further action.
Yeah, Melissa, you were talking about building those relationships and how that has been so key to helping you develop a really, really strong evaluation team. You know, we often tell communities that building relationships should be an important activity of any partnership that, you know, is striving for success. In fact, you all will probably remember in our Take Action cycle that work together is a key activity. So, to elaborate a little bit more about how building the relationships with the universities, how that has helped you with developing this evaluation structure and how that has impacted and benefited LiveWell Greenville.
Okay. Yes. When looking for evaluators that we can really find that mutual benefit from, one of the most important things for LiveWell is to find someone who is familiar with the CBPR framework or has worked extensively with the community. Also, we find that we really need a commitment from the evaluators to actively be involved not only in the evaluation and research activities, but as active work group members. This means they attend the same monthly meetings with the other coalition members where they interact with and contribute their knowledge of evidence-based practices and evaluation strategies in an ongoing, mutually reinforcing way. Secondly, we look for evaluators who have an area of expertise in the specific community setting or intervention strategy that LiveWell is undertaking. This allows me as the PI to focus on sustaining our overall evaluation plan while also building a team of content area experts. For example, one of our most recent projects was with the At Mealtime Work Group with the development of a menu labeling initiative to promote the purchase of healthier food items. For this evaluation, we sought an expert from Furman's Business and Accounting Department who had expertise in the use of pointed decision prompts, such as menu labeling, to influence consumer behavior. Once identified, this evaluation specialist then worked very closely with me as the PI to develop an evaluation plan and reporting strategy that met LiveWell and the community's needs. And one of the last things that LiveWell looks for, and most importantly, is evaluators who understand that because we're a grant-based community organization, our funding cycle often ebbs and flows. Since we have a commitment to CBPR in the community we serve, we seek evaluators who are passionate about community work even when evaluation funding is not readily available.
That's good. So, you know, we talked a little bit about this, how important this mutual beneficial relationship is to your work. Tell us a little bit about how the universities benefit from LiveWell Greenville's relationship.
Okay. While LiveWell certainly seeks to support our evaluation specialists financially, this is not always the reality. So we recognize that we need to support them in other ways beyond this monetary investment. This type of support, just as you mentioned, ensures that ongoing mutually beneficial relationship between the community, LiveWell Greenville, and the universities. One of the central ways that LiveWell Greenville creates a mutually beneficial relationship is by building and supporting relationships with community members and organizations that provide access to data. For example, through LiveWell's ongoing relationship with Greenville County Schools, we are able to receive youth BMI, aerobic fitness, and demographic data. Our at-school evaluation specialist then uses this data both to develop community reports, identifies communities of need, as well as advance their own personal research line. Another way that LiveWell Greenville supports our evaluators is by actively engaging coalition staff and partners in various phases of the evaluation process. This means LiveWell Greenville helps develop the evaluation plan, helps identify data sources, participates actively in data collection, and aids in reporting. This support from the coalition helps reduce the burden of responsibility on the evaluator and their students. Lastly, LiveWell Greenville actively supports our evaluators' opportunity to present both at local and national conferences and submit to peer-reviewed journals. This includes both the actual development of presentations and manuscripts, as well as supporting travel and other expenses when at all possible.
And then the partnership, as you had said earlier, also helps benefit students. There's this opportunity for student experiential learning no matter where they are in their curriculum. So tell me a little bit more about the role that the students actually play in evaluation and how they have benefited from the relationship within the partnership.
As part of our LiveWell Greenville evaluation team, we have always sought to engage students in both community intervention efforts and the evaluation of those efforts. For our undergraduate students, this consists of the LiveWell Greenville Fellows Program, which is run through Furman University. This opportunity includes two stages, the Fellows 1.0 and the Fellows 2.0. In the first stage, 1.0 fellows learn about the overall coalition mission and each of the work groups. They also have the opportunity to participate in data collection, volunteer at events, and attend coalition meetings. Students who enjoy and excel in their 1.0 experience can then apply to participate in the 2.0 fellows. Selected 2.0 fellows engage in either a mentored research project with one of our evaluation specialists or a coalition's operations experience mentored by the coalition staff and partners. Students select opportunities based on their future academic and career goals, with each experience having defined learning objectives and at least one concrete deliverable, such as a community report or presentation that students can add to their resume. In addition to this undergraduate fellows program, LiveWell Greenville has also hosted student practicums from master students and also offers opportunities to collect and analyze data as part of a student's master's thesis or their PhD dissertation.
Great. I mean, it just sounds like there's so many opportunities for people and to benefit from this evaluation structure. It's really amazing the good work that you guys have done. And I do want to remind our participants on the webinar today that you can use the question box to ask any questions. We will be going to the questions very soon. So I want to encourage you to get your questions in. Now, Melissa, you have provided a lot of information about your evaluation, how your evaluation team functions. So can you provide us a quick recap with this visual, please?
Mm-hmm. So as you mentioned earlier, we've been able to develop this evaluation framework on a fairly limited budget. So this diagram represents how between our community partners, students, and university evaluators, we actively seek to find intersections that contribute to every organization's goals. By finding the common connection between each of these three major contributors, we sustain those mutually beneficial relationships. So the first intersection is between faculty and the community. Through this facilitation, we are able to allow faculty researchers with the opportunity to access data from the community while also fostering a sense of civic responsibility and community engagement. And lastly, we're able to support applied research that is presented at conferences and academic journals. And the next intersection that we see is between the students and communities. This is also very important to universities because it allows students to have opportunities to gain access to real-life experiences with community partners that enrich and engage both their academic and professional development while also further augmenting the work of our community partners to improve health. And lastly, this intersection also promotes interaction between students and the university faculty, where we provide an outlet to mentor students and foster academic growth, which the university supports as well.
Thank you. Now, as I mentioned earlier, communities are often challenged with finding ways to fund evaluation. Is funding necessary to evaluate effectively?
Absolutely. So LiveWell builds in evaluation into any funding request we submit at a minimum of 10% of the overall request. This commitment to investing in evaluation can seem daunting at first, or at times it may seem more vital to invest in the intervention efforts in the community themselves. However, in our direct experience, we have learned that these evaluation findings provide a feedback loop that helps us identify which efforts are most successful or where improvements can be made. Having this knowledge allows us to target our intervention dollars to areas of most need while also using strategies with quantifiable results of impacting health. So this is especially important when your funders want to see results, and so providing them with an evidence base is going to make funding more attractive or feasible. So LiveWell actively seeks fundings from a variety of sources, including local coalition partners and foundations. Just like we invest in our community partners, we ask them to invest back in us. We work with our evaluators to apply for grants within the university and also apply to scientific-based grants that are initiated by the evaluators themselves. And then lastly, where LiveWell has achieved the most success is through our large federal grants through the Centers for Disease Control and Prevention. I want to note that this varied funding approach has been very important to our long-term success. It helps create sustainability because the coalition is not dependent upon any one source. This doesn't mean that the scope of our work does not ebb and flow based on funding, but it does ensure that we are able to cover our operating expenses throughout the various grant cycles and continue the core of our work.
And Sally, I kind of want to bring you back into the conversation because I want to ask you about how this commitment that your partnership has made to evaluation has resulted in your successes and lessons learned.
Well, Melissa did such a fantastic job of explaining that continuous feedback loop. As a partnership, I really do feel like that has given us such a huge advantage over similar partnerships because we've had such a strong relationship with our evaluation team, our local and regional universities. The level of our work is elevated not only in terms of the initiatives that we're able to implement, but also in the ways that we're going about making collective decisions. So if you think about having those people at the table, we have this fantastic data at our disposal that many other coalitions don't have. On top of which, we have these great minds, these people who study the fields in which we're trying to make drastic changes in. So we have them at the table as well as these invested partners. So when the three come together, it is that continuous mutually beneficial relationship. That's kind of been the heart and soul of our work from the very beginning. We've always looked for the win-win-win so that everybody feels like they have a vested interest at the table. As Melissa mentioned, so that when funding, it ebbs and flows, we have people who stick around past the dollars. I also feel like this has enhanced our ability to plan to meet the needs of the community and enhanced our ability to align with those local, regional, and national funding sources. We've been successful over these past 8 years, and that is due in no small part to our commitment to that continuous quality improvement via evaluation. In addition to the typical focus on process measures, the relationships with our evaluators have allowed us to move forward to some real local data that supports the impact of our work and the work that our partners are doing in real time, so we don't wait 6 years for the next national report to come out. We've got the good local data available at our fingertips within a year or two.
Absolutely. And some of the key things that struck out in my mind as I was listening to you and Melissa, some of these key words is building relationships and having an equitable role, mutually beneficial relationships. And those are some of the things that we at County Health Rankings and Roadmaps promote because we know they do help to help augment the success of any partnership. I want to thank you for sharing about LiveWell Greenville and your evaluation structure. And now I'm going to turn it over to Tony to see if we can answer some of your questions.
Great, thank you, Erica. So yeah, let's see if we have some questions here for Melissa. What kind of obstacles do you face in conducting community-based participatory research, and how do you overcome them?
So one of the biggest challenges of community-based participatory research is also one of the things that I've mentioned as its strengths, is that we're actively engaging the community in each process. And so that means that you have to stay committed to that. And that at times that means that the research or organization agenda in terms of improving community health and what the community wants to actively tackle or target don't necessarily align. And so you have to find either that happy medium, or you have to learn that maybe that what we hope to accomplish might happen down the road, and right now we really have to focus on building the relationship with the community and targeting the health concerns that they are most interested in.
Okay, great. Thank you, Melissa. I'm going to give you one more question and then maybe turn it over to Sally. Can you give us some examples of, this is one of the questions that kind of came up in a bunch of different ways, is of health indicators that LiveWell Greenville uses to measure?
Yeah, our most important health indicator is youth BMI, and we receive that data through developing a long-term relationship with Greenville County Schools, which Sally mentioned is a consolidated district with 85 schools. So it gives us a really good snapshot of what the actual community BMI rate is and where disparities exist. So we use this as our overall measure across all of the work groups to determine long-term community health. But we also select indicators for each of the community settings, and those vary by what the intervention is. And I certainly want to invite everyone to visit our evaluation website, where we have all of our current projects, who the evaluation team are, and what the measures are. But for example, I'll go back to our menu labeling strategy. So we really looked at what the goal of creating a healthy menu was, and that was to change the foods that people purchased when they were in a fast casual or local restaurant. So we selected a measure, which was the sale of healthy food items, and that was our outcome measure, and then we developed an intervention strategy that aligned with obtaining that. And that's kind of how we do select all of our measures, is that we develop a logic model in which we outline our intervention strategies and how those will help us achieve the outcome of interest, and then we select a data source that aligns with that outcome of interest.
Great, great. And in just a little bit, maybe we could talk about, because we have a little bit more time, like how maybe some examples of how you use the metrics to make decisions about interventions that were not working. But I'd like to kind of turn it over to Sally first. Is that okay?
Yes.
Okay, great. Sally.
Yes.
You talked about action plans earlier. Can you tell us how those plans are developed? I know a lot of communities are actually putting together action plans, and how are they used to implement community health improvements?
When LiveWell Greenville first got started, we had a huge community event in which we invited all of these interested people to come together and to start to develop what became our action plans. And so from the very first days, we've developed those plans very work group specific. So we bring together those key influencers as people who really know that setting or that topic area really, really well, have a vested interest in seeing it change. And so then when we design those community action plans, we start with that huge brainstorming. If money were no issue, if political will were no issue, what will we do? Lay it out there and then narrow it down to what's feasible right now. And as we get to what's feasible right now, we start to lay out a true action plan that says what it is, the steps that are included, which partner is key to leading that step, what other partners, whether they're at our table or not, need to be involved to make that happen. Make it time-bound, so find a time by which we hope to have it achieved, and then starting to look at how else we might evaluate it. So all tied into that logic model that Melissa mentioned earlier. We have some examples of that on our website if anyone would like to check out our schools action plan. We have some of our other work group action plans on there as well. But the key piece is we update these often. We don't have a time frame by which everyone gets updated. We really look at, have we achieved the things that are on the plan? Are they still achievable? And then we shift, as they're done, because it's typically policy, system, or environmental change, it's done. It doesn't have to be done over and over and over again. Once we changed the school lunch menu in Greenville County Schools, it was changed, and it went from a highly processed product to a highly a scratch-made healthy meal that's rich in fiber and lots of fruits and vegetables, and it's done. That's already part of how they do their work from now on. And so we really work to do all of that. And then my job as the executive director is really to see those interconnections between those work groups. So if each work group has their own action plan, it's my job to merge those together to a full community action plan that really looks at globally, how are we going to make a collective impact that really changes the landscape of all of Greenville County and makes it as easy to make a healthy choice as it is to make an unhealthy choice on a day-to-day basis.
Great, great. I really appreciate that, Sally. I'm going to just, a couple more questions have come in that are kind of different. So I'd like to know about what techniques have you used to overcome some of the more entrenched aspects of suspicion and mistrust between academia and community.
So I mentioned earlier that our evaluators, we really encourage them to be active workgroup members, and for there not to be any type of distinction between the role that anyone has in terms of importance. And so when we are really open about what data we're using, the intent for the data, and I would say most importantly, when the community members see that report in hand, when we present it to them and then begin to facilitate a discussion around our evaluation findings and how those can be used in their community, we see that that trust is there. We see that they understand that we might be presenting at national conferences, or we might be writing peer-reviewed manuscripts, but what we're really there for is to do community good and build relationships.
Gotcha, gotcha. And just, another question kind of tied right with that one is any difficulties in sharing data and partners?
Yeah, we definitely have had challenges of just building trust in terms of if sometimes we get protected data that might be HIPAA compliant, which is generally medical data, a FERPA compliant, which is data associated with children in schools. And it was really just open communication, a development of a memorandum of understanding that was signed by both parties, or a data sharing agreement in which we really outlined what the data was, how it would be used, and how it would be reported. And so to have those guidelines in place, I feel really made people more comfortable with sharing of sensitive data.
Gotcha.
And Tony, if I might add to that, just one brief statement. I think in both that question and the previous question that Melissa answered, I think patience is key to a lot of this. These relationships did not happen overnight. So we've been working on this for 8 years. If we had gone in day one 8 years ago and said, hey, we want all your BMI data and we're going to publish it and put it together and we're going to use it for your good, but we really, we need this from you, we would not have any access to any of that work. So this is taught, and I'm not a very patient person, and neither is Melissa, but it has taught both of us that very valuable lesson that time really does make things happen, and we have to sometimes just sit back and wait for the right time with those subtle pushes rather than charging in from the very beginning.
Sure, I really appreciate that. Oh, go ahead, I'm sorry.
Oh, and the last thing I was going to add to piggyback into what Sally said is we try to go into the conversation of, here's a service we have to offer, what do you need to know? So what are the holes in terms of so for example, what does the school district need to know about their students so they can improve health? And so sometimes, like Sally said, this means being patient. This means that maybe we're not analyzing the data that we had initially planned upon or wanted to, but building that long-term relationship where they see value in us is what really has made us successful.
Great. Well, thank you so much. I'm going to ask one more question, and then I'd like to turn it back over to Erica. And just remind everybody, we do have a time for after class to ask, because I didn't get to all the great questions that we received. So, but I'll ask this last one and then turn it back to Erica for now. You mentioned a lot of different partners, and I just wondered about the engagement of the healthcare, local hospitals and health departments.
That's a great question. So we have always had some representation from the health department's been very active and involved from very early days. And we have 3 healthcare systems in our area. So 2 that live right here in Greenville County and 1 that sits right on our border. And all 3 have been engaged to some extent over the years, and sometimes it ebb and flows because those communities like ours that have multiple healthcare systems, they know competition is a real issue. What we have been able to do with time is really establish ourselves as the neutral party. And so we have been able to bring those partners together around a single entity, a single event, as well as a long-term relationship with LiveWell Greenville to really make a large impact, to the point where just this past year we were integrally involved in helping with their community health needs assessment and helping to tie some relationships between those entities. And they have actually, over the last 6 years, been working towards a single community health needs assessment rather than having competitive ones amongst them. So they've been very involved, and we've been really glad to have them at the table, and they're all investors in the coalition as well. That would be important to remember.
Thanks for sharing that. Thanks, both of you. That I understand what a great lift that is, and it's really impressive that you were able to do that and get them all to work together. And it does take time. So I'm going to turn it over to Erica and have her wrap up our today's webinar. Thank you.
Thanks, Tony. And Tony, as Tony was hinting at earlier, because we've had so many great questions that have come as a result of our webinar and our guest today, we will have what we call an after class, and I'll tell you a little bit about that. But at the conclusion of the webinar, we're going to stay on for a little bit to try to answer some additional questions, because some of these questions are just fantastic. But anyway, thank you, Sally and Melissa, for getting us started with answering some of these questions that have come from our audience. Let's revisit our guiding question for today, and hopefully today's webinar has provided you with some insight into how you can partner with the community and possibly local universities to evaluate your community's efforts and your partnerships efforts, rather. And we know that implementing community change, including a comprehensive evaluation plan like Melissa and Sally have been able to achieve, is a lot easier said than done. So here at County Health Rankings and Roadmaps, we have community coaches who provide community leaders with direct support to strengthen their capacity to advance health improvement efforts in their communities. Our coaches are strategically located across the country, from California to Colorado to New Jersey, where Tony is, to Florida, where I am. And coaches guide partnerships in the use of the Action Center's many practical tools and resources. You heard some tools come up during the question and answer period, like a memorandum of agreement, a logic model, an action plan. If you want to know how to use those tools, connect with a coach. All you need to do is to simply click on one of those peach Get Help buttons that you'll see on our website, and we actually have those types of tools within our Action Center that you can access as well. So we started with these reflection questions at the beginning of our webinar, and I'm asking you to commit to taking one idea from this webinar for action. And don't forget to check out the tools and resources in our Action Center to help you commit to that action. Of course, coaches like Tony and me are available to give you practical guidance as well. And I want you to stay connected with us. We have a presence on social media, and you can communicate about County Health Rankings and Roadmaps, as well as get information about our upcoming webinars. We have a presence with Twitter and on Facebook, and you can also subscribe to our e-newsletter. So I want to thank Melissa and Sally for joining us today, and I just want to remind you that we will have a few minutes to spend for what we call like an after-class discussion today, because Melissa and Sally have agreed to stick around for that. But I do want to thank you, our viewers, who have taken some time out of their day to spend it with us to learn more about evaluating effectively and efficiently, and I invite you to participate in our future webinars. This officially concludes the webinar, and for those of you who would like to stick around for the after-class discussion, please do so. So Sally and Melissa, I thank you for agreeing to stay around for a few minutes. I am actually going to turn this back over to Tony so she can ask some of the other questions that have come up during the webinar.
Yeah, hi, I'm back, guys. One of the questions that came in was quite a good question, but it's going to take a little bit more time, is what does your management administration team look like handling this kind of large program? And I know that there's information on the website, but they kind of want to know a little bit more about how many staff are dedicated to it and kind of in what roles.
This is Sally. I'll be glad to answer that question. And it's a little convoluted. So over the course of our history, we have had a team that is as small as one part-time staff person and as large as 13, with the majority of those being full-time. So when we were at the height of our community transformation grant, we really grew pretty explosively. Currently, we have a staff of 8, and we are made up of 4 full-time and 4 part-time staff members. Those include myself as an executive director. We have a development director. We also have 2 grants administrators. They're both part-time, and they split basically a singly funded position. In addition to that, we have partnership coordinators, and those are kind of the heart and soul of our work. They connect directly with those evaluators at the university level, and between the 2 of them, they really help run those work groups. So each program coordinator may have 2. One has had 3 work groups to work with. That's kind of a pretty big workload when we're working with that many community partners. And so if that gives you an idea, like I said, we've had an operating budget that's been as low as, well, when we very first started, it was 1 person and $150,000. At our height of the Community Transformation Grant, we had 13 staff members and a budget of about $1.3 million, but I will say a good portion of that funding also went out to our partners and did not stay just within our organization. I hope that helps to answer that question.
Really does. Thank you. Go ahead.
Sally, should we touch on the roles of our respective leadership team and advisory board at all?
I think that might help to give scope to our work. So as I mentioned earlier, we have a leadership team which serves as a traditional board for any kind of nonprofit. We also have and that leadership team is made up of key influencers in the community. So what we really look for are those people who could get in the door of the CEO or the executive director of an organization, but is not necessarily that top dog, because we know that those people typically can't give us the time and the energy that we really require of our leadership team. They are responsible for not only kind of our keeping us legal and all of our oversight, they are also in charge of strategic direction, and we really want them intimately involved in our work. And then our leadership advisory board are the top dogs, so the CEO of the hospitals, the health director, business owners, insurance agency owners, those kinds of folks who will give us their time, an hour or so, 3 or 4 times a year, but not much more than that. But what we ask of them is global oversight, so giving us an idea of big strategic changes that might be coming down the pipe given the community's political will or funding cycles, and then also their continued support to allow the people who work for them to stay at our table, because many of them give us a pretty significant investment of their time.
All right, great. That's super helpful. Definitely feel like I understand the scope of the staff size and administration. I'm just kind of wondering, this question came in from Matt earlier, and it was more getting into the using the data to make changes. And I know you did a great job of explaining that, but I think he's looking for like more specific on, what metrics you're using to determine what might be cut, what the cutoff might be in terms of eliminating or changing an intervention. Could you speak to that with a little bit more specificity?
Yeah, this is Melissa. I'll certainly do my best, and Sally, hop in if you can think of anything. Like we mentioned earlier, we look at process, impact, and outcome. So process being, did we do what we actually said we did, and then impact being shorter-term changes and those long-term outcomes like BMI. An impact might be, if our goal was to intervene around physical activity policies in out-of-school time settings, did that out-of-school time setting actually change a policy? And unfortunately, I don't think that there's any one cutoff, but I think that we kind of look at the overall picture of those three types of evaluation. So around process, we look at things, how feasible was it to implement? Did the community or sites or organizations that we were hoping to target actually participate, and did they perceive it as being meaningful? So not only did and then the next one would be impact and outcomes. So not only did the organizations that we've been targeting find it valuable, but did they actually make the short-term policy systems and environment changes that we asked them to? And then beyond that, long-term, we look at things like, are we actually changing youth weight and chronic disease factors? And I wish I had a little bit better answer, but sometimes it's just using our intuition of what the bigger picture is and having an open conversation with the evaluator and the partnership coordinator and our coalition partners around how to create a bigger picture with these three types of evaluation and make an informed decision.
I could think of one quick real-world example of how we use data to kind of decide next steps. A few years ago, we implemented a power buy among our after-school programs. So the idea was that our after-school programs wanted more fresh produce for snacks, but realized it was more expensive than the 25 cents per kid per day that they were spending. And so they wanted to look at a way, could they pool their resources and have a collective menu and have a feasible way of getting this produce at a lower price because they were buying at a higher volume. And so we really utilized a pilot or a feasibility study to follow that process and see if it was feasible. And what we found is in reality it wasn't feasible because we couldn't get the sites to all agree upon the same menu, and this place hated hummus but the next place loved it, and getting it to the price per kid, it just changed. There were so many hoops to jump through that we realized, using some real-world data that we were collecting throughout the process, that over the course of that year, this was not going to be a successful way to reduce the cost. But what it did lead us to was a better relationship with Greenville County Schools, which already had a better buying power, and they were tied into many of those after-school sites, so that we were able to connect them with that resource and track that success to say, okay, this is a much more economical way to provide this community need and really get to what we were trying to do. So in both of those cases, the data helped to end one version of the intervention and start a new one.
It's great. You know, we have a lot of our audience is still on the line, so I'm going to ask one more question, but invite those people that are still on with us to send any more questions you have in the panel, because this is the last question that I have here, which is good. It's focusing on the work groups and the who of the work groups. What kind of partner representatives are participating in the work groups? So, you know, maybe you can kind of give us an idea on just one work group, like maybe I think they're thinking about what kind of level they're at too. You know, are they directors? Are they community folks? What does a work group look like?
Well, one thing I would invite you to do is go ahead and go to our website and look at each of the different work groups. They each have their own tab under our community actions section, and really all of the partners are listed there for each individual work group. But to give you an idea of who's involved, as I mentioned at the leadership team level, it is the influencer. At the leadership team level, we have really from the very beginning, we have followed the principles of kind of the social innovation chain or social innovations theory on collective impact. We set up our model to be less traditional, kind of breaking molds, changing titles, and so our group leaders are called lead facilitators, and their job really is to facilitate discussion. And so to facilitate that collaboration discussion around the table and get people working in the same direction. So our facilitators typically are those influencer level because they do sit at our leadership team table. as we look at who's actually on the work group, it can vary across the board from anyone who, like if you look at just our out-of-school time work group, many of the people at the table are providers. So we've got real-world examples of what could work and could not work at the, as we look at proposed changes in policy and system environmental opportunities there. We also have, as we mentioned, the evaluator at the table, but we have usually other agencies, entities that have a vested interest in seeing something good happen at an out-of-school time level. So we have the Department of Social Services that does some oversight and some accreditation of those centers. We have the health department at the table. We have relationships with the local health systems who have some vested interest in seeing that happen. And so that gives you like a picture of how each of those work groups are set up. We do not actively seek general volunteers off the street. What we have found is that, when we get that person who really just wants a volunteer opportunity, it takes so long to figure out this work versus somebody who's really involved in it and they can hear about a project that we want to do. They're like, that's exactly what we need. I can make that happen in my agency. I can make that happen in my entity. But we do actively seek to bring in community members to the table and to the conversation, especially as we look at implementation. It's just they're less involved from a month-to-month standpoint, if that makes sense.
Sure, that really makes sense. So from the audience, I don't have any more questions at this point, but I know that I'm going to have more questions for you. My communities may have more questions for you because you've done a great job of explaining this, and there's many communities that aren't as far along, so they really appreciate this guidance, and I thank you so much. Erica, is there anything final that you want to ask? Or
I just want to thank Melissa and Sally for being so willing to share what LiveWell Greenville has done. As a native South Carolinian, I'm particularly proud to feature your work with County Health on a County Health Rankings and Roadmaps webinar. Thank you so much. And I will also add to what Tony was saying. Evaluation is one of those necessary action steps that every community knows that they need to do, but there are often challenges with it. Thank you so much for laying out a process that I think is manageable for communities to adopt. And I want to remind our listeners that the County Health Rankings and Roadmaps, we're here to help you. We can actually give you guidance to help you set up an evaluation structure that will work for your partnership. So thank you so much for everyone and for your time. Thank you, Tony, as well. And this officially concludes our webinar. I hope everyone has a good afternoon, and we look forward to seeing you on future webinars.